You've probably heard a lot lately about vaccines and how they are a great way to cure many diseases. In fact, the vaccine was first used in 1796. That's a long, long time ago. So now, here we are with a vaccine that works to defeat breast cancer. Yes, you heard correctly. Here's how it works. Normal healthy cells know when to grow and divide and when to rest. Cancer can be simply defined as a loss of control over cell division. Cancerous cells never rest but continually grow and divide, spreading throughout the body. They destroy the architecture of important organs and tissues, similar to weeds disrupting the organization of a garden and choking out the useful plants. Most breast cancers arise in the lactiferous ducts of the breast. These are small tubules that conduct milk from the mammary glands to the nipple. A normal lactiferous duct is an open tube whose walls are lined with a kind of cells called epithelial cells, which form a part of the duct's normal structure. Cancer develops slowly over time. The epithelial cells can accumulate mutations in their genetic material that slowly changes them and destroys their ability to rest, resulting in the beginning phases of uncontrollable growth. When they have changed enough, they grow and divide to the point where they begin to completely fill the lactiferous ducts. This is the earliest form of breast cancer, called ductal carcinoma in situ, or DCIS. It is also sometimes called stage 0 breast cancer. Eventually, the cells will penetrate the wall of the duct and begin growing in the surrounding breast tissue. This is invasive breast cancer. As the cancer spreads beyond the area around the duct, even to distant locations of the body, it has become metastatic breast cancer. As the cancer spreads, it becomes more and more difficult to treat, so it's best to identify cancer early and begin therapy as soon as possible. About a quarter to a third of breast cancers produce a protein called HER2. HER2 is considered a poor prognostic indicator, and women with HER2 breast cancer are more likely to be invasive, metastatic, and recur after standard treatments. In our next video, we'll take a look at how the immune system functions to see if it can be persuaded to fight against cancer.
Can our immune system be persuaded to fight cancer? In order to answer this question, let's talk about how it protects us from bacteria and viruses. The immune system is composed of white blood cells, of which there are many types, each with their own unique roles in identifying and destroying outside invaders. But for the sake of simplicity, let us reduce the immune system to only two kinds of cells. One of these is called a dendritic cell, the other called a T cell. To use a military analogy, dendritic cells are like the recon scouts, while T cells are like the fighting generals of the immune system. Dendritic cells stand watch throughout the body and can sense chemical differences between self cells and outside microbial invaders. When they sense these differences, they actively collect unique proteins from these threats and decorate their own surfaces with the intruder's personal proteins. The dendritic cells then travel to areas of the body called the lymph nodes. Here, they present or show the invader's proteins to the T cells, which then divide rapidly, forming a disease-fighting army, which then leaves the lymph nodes to go on a search and destroy mission. Clearly, our immune system is a powerful force, but can it be persuaded to fight cancer the way it fights bacteria and viruses? Check out our next video to find out.
This is how we persuade the immune system to fight cancer. We exploit the natural properties of dendritic cells to make a kind of vaccine-like immunotherapy against early breast cancer. To accomplish this, we remove the white cells from the blood of a patient with DCIS and through a special procedure, isolate the dendritic cells. We culture the cells overnight in a nutrient medium that contains conditions favorable for dendritic cell function. Then we add two things to the dendritic cells. First, we add some of the very chemical signals dendritic cells use to identify foreign microbial invaders. Then, we add a synthetic version of the HER2 breast cancer protein. HER2 is a naturally occurring protein in the body, which is greatly overproduced by some breast cancers, marking them as abnormal. These conditions fool the dendritic cell into behaving as though it has discovered a dangerous microbial infection. These cells become highly activated and decorate their surface with pieces of the synthetic HER2 protein, just as it would have done with proteins from a microbial invader. After this has been accomplished, the dendritic cells are collected and injected back into the body of the cancer patient. The dendritic cells seek out T cells just as they would during a microbial infection, but this time they are showing the T cells a protein that marks a breast cancer cell rather than a bacterium or a virus. Nonetheless, the T cells behave identically, multiplying into an army of cells that will go on a search and destroy mission against anything bearing the HER2 protein, namely the breast cancer. So anywhere the breast cancer cells reside, the T cells will seek them out and attempt to destroy them. After years of work, research, development, and patient trials, this approach to fighting cancer is really paying off. In our next video, we'll take a look at the evidence that yes, our immune system can be successfully enlisted in the fight against cancer.
After years of hard work, research and development, and patient trials, it appears that yes, our immune system can be successfully enlisted in the fight against cancer. Here are some photographs of microscope slides from a thin section of breast tissue from an early HER2 breast cancer vaccine recipient. The slides are stained to reveal the presence of T cells. The first slide is from a biopsy taken before the vaccine was administered. You can see in cross-section a lactiferous duct that contains the growing tumor cells. Surrounding the duct is a light scattering of brown staining T cells resident in the breast tissues. The second slide is from diseased breast tissue sampled after vaccination. It is apparent that after vaccination there is a massive influx of T cells that congregate around the tumor cells growing in the duct, showing the effect of the vaccine. Since 2004, we have provided this dendritic cell immunotherapy to over 200 patients with HER2 breast cancer. With this treatment, many patients have had their tumor disappear. Not only that, this same approach should be effective against most solid tumor cancers. All we have to do is change the target. A lot of preliminary research has already been done to prove that point. As always, funding is the fuel needed to make this immunorestoration therapy widely available to those with cancer who are in need. We look forward to bringing you more exciting news for a life without cancer. To find out how you can help, please visit the website on the screen.